so the next person taking over will have a completion with that patient.
Okay. So doing this in 18 years, you've probably seen some gruesome things. Has there been anything that kind of has pushed you to the side as a professional, or have you not had any run-ins?
Probably a very ill, almost newborn would probably be the most scary type patient for me, because they can't communicate to you. And adults can, or seeing a patient come in talking to you and then have an illness that all of a sudden they've deteriorated and can't talk to you anymore. You know, so, and you can't pinpoint, you know, or you can't stop the process. So the ones that you really can't help are frustrating, and they do have an effect on you. Or the ones that you can't really interpret because they're ill, they're little, they can't tell you what's going on. You know, those are probably the most troublesome, because communication isn't there. You know, the family's so upset, sometimes it's hard to get to the bottom of what actually happened.
And when you have those run-ins, how do you push aside your emotions to complete the job that you're supposed to do?
Well, you try to focus on your tasks that you're doing, and normally if you have a very critical patient or one that is emotionally involved with you, there's others with you, so you all do your little bit, but sometimes it's hard. I mean, you do sit there and cry with the families. I mean, you can't hold your emotions in. If you held them in, you'd be so built up and that you couldn't think clearly. So if you let a little bit of emotion out, then you can carry on. And they know that you, by showing a little bit of emotion, you're communicating to that family, whoever, you care about this patient. You feel their pain. You feel their discomfort. You feel their fears, and that you're equal with them. You're not better, you're not worse, but that, you know, you're there for them. And I found, you know, early on, it's tough, but if you can deal with those and just show a little bit and be there for the family members, patient, it's all a whole picture. So that the patient needs everybody around them. So you have to take care of everybody.
So you've left everything on the table as far as a sense of taking care of that patient that day.
Mm-hmm. I left early on because I had a patient who was diagnosed with cancer. Yeah, you know they're going to die. Or respiratory. There's two of them that I can remember. One was an elder lady who had severe respiratory problems, and I was a young nurse. And 3 o'clock in the morning, I noticed a change in her. She didn't seem to be, you know, breathing as well and all that. And I thought, do I wake up her elderly husband, have him come in, or do I just wait and see what happens? Because she didn't want everything done for her. She wanted just to go peacefully when it was her time. But I called him, and he came in and he sat by her bedside. And because of me calling her when she passed away, he was able to donate her eyes to someone. So her corneas were then harvested and used for someone who needed them. So that's where you get your completion and your satisfaction.
Wow, I think that would probably bring emotion out in anybody at that point.
And the fact that he could do that, you know. Another one, he was dying. I called the wife, and she got there just as he was dying. So you try to have them think of it. That was your family member, you know, your grandfather, your mother, your father. Wouldn't you want somebody there? You don't want them to die alone. A lot of people think they go to the hospital, they're going to die alone. Now, you know, you find that minute or two and be there. If you're just sitting at the bedside saying, I'm here for you, you're not alone, let him go peacefully. And that's where the Lord intervenes. So, I mean, it takes that guidance too.
Right.
You know, he has a bearing on your sixth sense.
And do you currently speak any other language other than English?
I know a little bit of Spanish, that I can ask certain basic health-related questions. Just to get, like when you're in triage, you got to do it quickly. But as it gets more complex, then I need some assistance. And then we have a language line.
And you did mention the communication issues with infants, obviously. I think anybody would have that. What about as far as you running in with anybody other than English? Have you had anyone come through where you...
Definitely, especially in Houston, we're such a diverse culture. We've had German, we've had some of the Indian languages, you know, Far Eastern language, Filipino. And then the language line has, I think, 15 different languages, and you know, that you can call and get someone to help interpret with you. And they're 24/7, it's available.
Okay, so there's always that language line that's going to be there to help you out. Okay.
Right. That's the key, because you have to be able to communicate to get to the bottom of what's going on. Case in point, I had a lady come in when I was doing a triage in Arizona. And of course she was Hispanic speaking, and I just couldn't get to the bottom of it. picked up the language line. Found out this woman is 8.5 months pregnant, didn't look it, and was in labor. So I had to quickly divert her to where she needed to go. And without that communication and language line, you wouldn't know what's going on with her. And she might have delivered a baby in the ER, which is not the best environment. So that's where the communication is key.
Right. Especially at the job you do now as a triage nurse, and you're the first line of defense in there for that patient. Other than language barriers, has there been any other type of communication difficulties?
Sometimes culture plays a role in it, because different cultures, we're trying to get a patient ready to be seen by a physician. Our usual bit in America is they get undressed, they put a gown on. And some of the different Asian countries, women don't get undressed in front of a man, and they don't like to get undressed. So you have to, respect their culture. So you have to learn a little bit, and they like things done a certain way, or the husband does all the communicating for the wife.
Okay.
Even though there may not be a language barrier, she's not allowed. So you have to kind of look at the whole situation and nicely ask, is there a reason why I can't ask her that question? And show them respect. So communication and respect go hand in hand.
Go hand in hand. Okay. And where do you currently work at in the Houston area?
Oh, one of the local community hospitals. That's the emergency room.
What's the name of that hospital? Is that top secret? If they call
I
it in the
prefer not to
military?
say.
Okay.
I prefer not to delve in. It's just a general, that's one thing. It's out here in the Woodlands area.
Okay.
I can give you that, it's out there.
And have you been there since the Tennessee departure?
No, actually I did 4 years of travel nursing.
Travel nursing. Explain that just a bit.
What that is you work for an agency, like you always have agencies that can fill in when you have a need. Like temporary agencies, you work in the general business world. But basically we work for an agency, and you have a set number of weeks that you go work for a hospital that's short, and you travel around the country and they pay you to do that. So instead of working for like a hospital or a clinic, you work for an actual travel company that hires nurses and healthcare professionals to fill in gaps throughout the United States.
How does one fall into that position of working for a travel agency?
Well, it's out there, you research it. Normally they like you to have 2 years experience. As a nurse, they like you to have at least 2 years experience. They look, you still go through just like you would hiring for any job. There's a skills checklist, and criteria to meet, and all that. And you work them with a recruiter, and you tell them where you're interested in going, what type of, job you're looking for. If you like, some people like trauma, some like teaching hospitals. I prefer the community ones. And then they let you know what's available. Then you have to do a telephone. A lot of it's done over the telephone interview. You don't meet in person because time constraints. You can be ready to go in as little as 2 weeks.
Wow.
And then once you finish one contract, a lot of times they want you to stay longer if you've done a good job. You do the same thing you would if you were on their staff. You work right along with their staff nurses, except you're just there for a temporary time frame. And so you learn different things, treat people from all over the country. You see different things, but people are the same. The basic needs. Everybody's basic needs are the same. But you get to see different places, and I said I got paid to travel.
And if you don't mind saying, where did you travel in this?
I was in Gainesville, Florida, Lewes, Delaware, Phoenix, Arizona, Albuquerque, New Mexico.
Okay.
I was out in Phoenix 3 times. Every winter I went out to outside Phoenix. That was great. So I kind of felt like I was one of theirs. I was there 3 years in a row for several months. But people are the same. I mean, the hospitals all run basically the same. They just might do it a little different way, have a little different equipment to use. So it keeps you up to date, and meeting new people. And so you have to have good communication.
Right.
Otherwise you can't. You can't be shy and introverted. And you have to have confidence in what you're doing. So you communicate that you're competent, you know what you're talking about. You come in and have a nice, easy going, I'm here to help. Communicate, I'm here to help, not to show you how to do your job. I'm here to help.
Right.
And you get along just fine, and I loved it. So then his company hired him back full-time. He was working part-time when we traveled, and the company offered him full-time work, so that's what brought us back here.
So your husband wasn't working at the time?
Part-time.
Oh, it was part-time.
It was part-time.
Okay.
So the job expanded, and